Patients who have experienced a myocardial infarction, MI, are at risk of various complications. One of the most common complications is cardiac arrest, which often occurs due to ventricular fibrillation. Cardiogenic shock is another potential complication, especially if a large portion of the ventricular myocardium is damaged. Chronic heart failure can also develop if the ventricular myocardium is dysfunctional. Tachyarrhythmias, such as ventricular fibrillation and ventricular tachycardia, are common after AMI. Bradyarrhythmias, particularly atrioventricular block, are more common following inferior MIs. Pericarditis is a common complication within the first 48 hours after a transmural MI. Dressler's syndrome, characterized by fever, pleuritic pain, pericardial effusion, and a raised ESR, tends to occur 2-6 weeks after a MI. Left ventricular aneurysm formation is associated with persistent ST elevation and left ventricular failure. Left ventricular free wall rupture occurs in around 3% of MIs and requires urgent pericardiocentesis and thoracotomy. Ventricular septal defect, seen in around 1-2% of patients, presents with acute heart failure and requires urgent surgical correction. Acute mitral regurgitation, more common with infero-posterior infarction, can cause acute hypotension and pulmonary edema and often requires emergency surgical repair.